You hold this. Okay.
My name is Roxanne Payton, and this is my informative speech for public speaking. I will be talking about dementia and how it affects the brain. I want you to take a minute and imagine not being able to recognize your child or significant other, or becoming lost in your own home. These are all symptoms of dementia. ALZ.org defines dementia as a general term for loss of memory and other mental abilities severe enough to interfere with daily life. This is all caused by physical changes in the brain. There are 4 common types of dementia, the most common being Alzheimer's. Alzheimer's accounts for 60 to 80% of dementia cases. Early symptoms include difficulty remembering names and recent events, as well as apathy and depression. It later progresses into impaired judgment, disorientation, changes in behavior, and difficulty speaking, swallowing, and talking. Alzheimer's brain abnormalities show deposits or clumps of the protein fragments beta amyloid or plaques, and twisted strands of the protein tau or tangles. This leads to nerve cell damage and eventually death to the brain. Vascular dementia is the second most common, and signs include impaired judgment and the ability to plan steps needed to complete a task. Vascular dementia affects the brain by blocking and damaging blood vessels that eventually lead to strokes or bleeding in the brain. Lewy body disease symptoms include memory loss and thinking problems similar to Alzheimer's, but present earlier symptoms of sleep disturbances, well-formed visual hallucinations, as well as slowness, gait imbalance, and other Parkinson-like movements. Abnormal aggregations or clumps of the protein alpha-synuclein develop in the cortex of the brain. The 4th is frontotemporal dementia, whose symptoms include personality and behavior changes, and language difficulty. Nerve cells in the front and side regions of the brain are especially affected. Those diagnosed develop symptoms at a younger age and survive fewer years than Alzheimer's patients. Dementia mainly affects older people, and the risk increases as you get older. A combination of genetic and environmental factors play a role in the common forms of dementia. Of course, your health and lifestyle choices can determine your risk, as well as head injuries and depression. Some ways you can reduce the risk is exercising, eating right, keeping your brain active, and your heart healthy. Remember to eat your Cheerios, folks. According to the World Health Organization, there are 47 million people living with dementia worldwide, and there are nearly 10 million new cases a year. There is currently no way to prevent dementia, but you can take the right steps to at least delay the onset of dementia. There is nothing better than making memories with loved ones and being able to remember those memories. Thank you. Point you down here. Shows how plaques and tangles form, and when they form, they kill the nerve cells in the brain. This is the beta amyloid clumps. They form together to make plaques that block cell-to-cell signaling. And tangles destroy a vital cell transport system made of proteins. Nutrients and other essential supplies eventually die. Right here you see a healthy brain versus an Alzheimer's brain. Thank you.